Humidification is recommended for every patient receiving invasive ventilation. It is also suggested for non-invasive ventilation, high-flow oxygen therapy, and patients with laryngectomy or tracheostomy tubes. Humidification prevents airway spasms, hypothermia, and improves comfort. There are two devices which help the airways stay hydrated. They are heated humidifiers and heat and moisture exchangers. Each device has positives and negatives. Join me this week as I discuss the differences between heated humidifiers and heat and moisture exchangers. Heated humidifiers work as follows. Water in the water chamber is heated to a preset temperature via a heating plate. As the inhaled air passes through the water chamber, it is heated, which allows the air to absorb water from the water chamber. The warm, moist air continues through the breathing circuit and is delivered to the airway. One of the biggest positives about using a heated humidifier is that the temperature and humidity of the inspired air can be finely controlled. The heated humidifier has a temperature gauge which can be adjusted to increase or decrease the temperature and humidity of the inhaled air. Moreover, the heated humidifier keeps the inhaled air at a constant temperature and humidity. It does not matter the temperature of the room air. The heated humidifier ensures the humidity and temperature of the air delivered to the airways stays constant. A big drawback with using a heated humidifier is that it requires electricity to use. The machine does not have a battery backup. This means the machine is great to use while lying in bed, but it is not practical for activities such as grocery shopping. Additionally, the machine requires either sterile water or distilled water to operate. The water levels need to be monitored to make sure the water chamber does not run dry. Lastly, the machine can be quite heavy. My heated humidifier weighs 8 pounds or about 3.5 kilograms. Heat and moisture exchangers, abbreviated as HME, are worn to prevent moisture and heat from escaping the airway. As a person breathes out, the exhaled air passes through the HME. The HME captures the moisture and heat from the air. When a person breathes in, the air passes through the HME. The moisture and heat retained in the HME hydrates and warms the air as it enters the airway. The basic components of heat and moisture exchangers are foam and paper. The HME is small. It is lightweight and easy to carry. The HME can fit in a pocket or a bag when not in use. It also does not require electricity to operate. HMEs have several negatives. First, the HME does not provide full humidification and it does not warm the air to body temperature. This may cause the airway to spasm. The HME may not provide enough moisture and may cause the airway secretions to dry out. This may cause mucus plugging of the tracheostomy or laryngectomy tube. The HME also has layers of material which air needs to pass through in order to enter the airway. This increases resistance, which in turn will increase the work of breathing. Some patients may find breathing with an HME tiring and uncomfortable. Please consult with your medical provider to decide which device you should use. In general, patients with a tracheostomy tube or laryngectomy tube should use a heated humidifier as much as possible. This will reduce mucus plugging the tube and possibly causing an airway obstruction. For non-invasive ventilation users, a heated humidifier will provide more comfort than using an HME. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.